Hi, I'm Steve Poftak, General Manager of the MBTA. Since the start of the COVID-19 state of emergency, I have made it my priority to communicate with the workforce through regular GM updates and video messages. I hope you found the information helpful. Many of you have asked COVID-19 questions on social media that are better answered by a healthcare professional. So this week I invited Dr. Ashish Jha to speak to us about what we can expect in the coming weeks. Dr. Jha is a professor of health policy at the Harvard T.H. Chan School of Public Health, the director of the Harvard Global Health Institute, and a practicing general internist at the VA. He's also been featured on numerous programs on Fox News, CNN, MSNBC, and the New York Times. Dr. Jha, I really want to thank you for joining us today. I want to thank you for informing our workforce and our riders about the COVID-19 virus.
Thanks for having me, Steve. I'm happy to be here.
Really appreciate it. First, can you provide an update on where we stand in Massachusetts in our response to the COVID-19 virus?
As you know, Steve, Massachusetts is one of the states that's been harder hit by this virus. I think we've done a very good job as a state, and we are really in that kind of flattening of the curve. And I'm hoping that over the next couple of weeks, which will be hard, we will finally be able to start seeing real declines in cases, and we will be on the better side of that curve heading down.
One of the questions we frequently get is in regards to face covering. Can you talk about the importance of wearing a face covering from both the rider and operator perspective?
The evidence has become clearer and clearer over the last few weeks that wearing masks, face covers, not medical masks, but face covering, is really important in preventing the spread of the disease. So when you wear a face mask or a face covering, you're not doing it to protect your own health. You're doing it to protect the health of everybody else around you. But the way this works is if everybody does that, then we're all protecting each other. And what we're doing through that is keeping each other safe. And it's our unified front against the virus.
I did want to pick up on one of the things you noted, that there are different varieties of face coverings. Can you talk about what are the differences between face coverings, non-surgical face masks, and N95 masks?
Yes. So N95 face masks really filter out the smallest of particles, and they're really very, very good for healthcare workers at keeping them safe when they're facing large amounts of aerosolized virus, right? They're taking care of very, very sick patients who have a lot of viral load, high viral load, and the N95 mask is really for them. But again, is really important for doctors and nurses when they're out on the front lines. For those of us who are out in the community, in a tea, on the bus, in a grocery store, what's really important is to have something over our mouths. And I think any kind of face mask that you can make at home, any kind of covering, will dramatically reduce how much of the virus you're going to spread to other people. And if all of us do our part and do that covering, then we all keep each other safe.
Are there other things that essential workers should be doing, both riders and MBTA operators, to protect themselves from COVID-19?
One of the essential issues, of course, is hand washing and using hand sanitizers whenever possible. What I say to people is try to avoid touching your face. That's a really critical thing. Virus on your hands isn't going to get you infected. It's when you then touch that to your eyes, nose, face that really is the risky thing. So try avoiding touching your face. Wash your hands as soon as you get inside. So if you've been out on the MBTA, if you have hand sanitizer, use it. Avoid touching lots of other things. And of course, to the extent possible, keep a good distance from each other, ideally 6 feet if you can.
And just to close, what else can you share with our frontline employees to keep in mind during this pandemic?
Yeah, this is a very tough time for our community, for our state, for our country, and really for the world. When I think about MBTA workers, I think of them as people who are essential to keeping our economy and our lives going. They're the ones that allow people to get to work so we can have groceries, so we can have essential medication. So you're really doing extraordinarily important work. It is incumbent on us to figure out how to try to keep you safe. I think it's important for frontline workers, MBTA workers, again, to do the hygiene stuff that we know is important. Cover your face, wash your hands, use hand sanitizer as much as possible, try to stay away from folks. And obviously, if you do start feeling sick, you've got to stay at home because it's really important at that moment to take care of yourself and protect other people as well.
Well, Dr. Jha, I know you have a very busy schedule. I want to thank you so much for joining us today to answer questions and share your knowledge on the COVID-19 virus.
Steve, and the MBTA and this entire group of folks who keep us moving are so essential. I'm proud to be part of this and try to be helpful. So thank you so much for having me on.
Great. Thanks so much. I'd like to close by restating the important service you provide in the fight to defeat the COVID-19 virus. As I reported on Monday to the board and the press, the data clearly shows that healthcare employees are a significant share of our passengers right now. Our frontline workers are driving the buses, operating the subway and commuter trains, maintaining vehicles, and monitoring stations and infrastructure. You are making it possible for workers at essential services like hospitals, nursing homes, pharmacies, and grocery stores to get to work. Thank you. I hope you found today's video informative. I want to thank you again for your service and for watching today.